Very good morning to everyone. My name is Derek. I'm Tegeka, and today I want to be taking us through a very simple topic, very simple discussion about some of the prevailing medical condition oba ekimu ku ekyo ekirwadde omuntu kyayinza okuba nga alina oluusi nga tamanyi kubanga alowooza kantu katono oba n'okuba nga tasobola kukinotisinga n'okulowooza nti it is something that is so crucial, needs a serious medical attention. So we shall be trying to look at a condition called gout. So gout, by definition, it is G-O-U-T, that is gout. So gout kirwadde, or it is a medical condition that results into inflammation of body joints. So we all know, as human beings, we have various joints in our bodies. We have joints in our toes, wansi mu bugere. We have a joint at the ankle area. We have joints at the knee area. We have a joint at the pelvic area. We have a joint at the shoulder area. We have joints at the neck area. So in brief, we have very many joints in our bodies, and what happens now is when these joints get inflamed or singa zizimba. Inflammation means swelling, or in Luganda you can say okuzimba. So gout is a condition that results from inflammation of one or more joints of the body. So you find there swelling of the joints. It can be of the hands, it can be the wrists, it can be the shoulder, it can be the knee area, it can be the tarsal area. When these joints get inflamed, that is what we call a gout. Now, what causes gout, if I may say? So before someone wants to know what everything about gout, what does someone need to know about gout? So, and what causes gout? Like we have said, gout is a medical condition that results from inflammation of the joints, which joints can be 1, 2, or more. And in most cases, it may be a sudden inflammation. Actually, it is, I always say, arthritis is inflammation of joints, meaning if someone's joints are inflamed, that is arthritis. But when it comes to gout, so gout is a form of arthritis that is characterized by sudden or severe attacks. So it can be sudden and severe attacks of joint pain. So someone feels joint pain that is intense, that is severe. Swelling of the joints and redness at the point of the inflammation. So that is inflammation, or that is arthritis. Now we are calling gout. That sudden and intermittent joint pain, swelling of the joints, that is what we are calling gout. Now, having understood the condition is now gout, what causes gout, and who receives gout, or so who suffers from gout? So In our body we have an acid called uric acid. Uric acid or uric acid formation comes due to breakdown of a component called purines. So the breakdown of purines in our blood results production of uric acid. So when uric acid accumulates into the joints, it is going to cause arthritis. Now what you are calling gout. That's why we have said it may be painful, swelling and redness at the joints. Those are the three distinctive features of what is known as gout. So when someone has gout, those are some of the symptoms that will be presenting. One, she will have a sudden and severe pain in the joints, often occurring at night in most cases. Why at night? Because during the night it is when high levels of uric acid crystals are being produced, and you find in one of the treatment, if you are going to, most of these drugs have to be taken at night because we expect a lot of uric acid production to be taking place at night. So that is gout. Other symptom a patient is likely to present with is what we call as fatigue. Someone feels fatigued in the joints, feels inability to move, weakness to move because the joints have been affected, and that's all rising from the joints, and you know that joints help in body movement. Next thing, we may have peeling oba kubanga ku lususu oba ku skin area where there is that inflammation, the skin may start to peel off at that point of a joint. So these are some of the clinical presentations that can result into gout. So what causes gout and where does someone need to get gout? Oba ekirwadde kiyitibwa gout omuntu akijjawa? Realize that one of the most predisposing factors oba ensonga eziyinza okuleetera omuntu okufuna gout, one, it can be family history. If in a family there has been someone before, let's say maybe it was a mother, it was a father that had gout or suffered from gout some time ago, meaning the siblings or the children to this father or mother are also prone to suffering from this condition, that is gout. Now in this regard, next is obesity. Most people who are too obese or who have much weight are also prone to this medical condition we are calling gout. Then the next thing is diet. So most of our diet is when we consume a diet that is high in meat, seafoods, sweets, and that diet is low in fruits and vegetables. That's why it is always a good recommendation for us to just in each and every meal to include a fruit or a vegetable. So diet that lacks most of these components, fruits. When you say fruits, we can mean avocados, can mean most of the berries, most of those fruits, and the vegetables. Talk about the greens, Maratha species, what we all know as dodo, nakati, shumsha, name of them all those green vegetables. So a diet that is low in those food components and the high of seafoods, meat is also likely to predispose to gout. And also certain medications for people who are taking drugs, certain drugs that you realize that we have patients or there are people that take certain medications, and as we all know in pharmacology that most of the drugs, actually not even, but all drugs have side effects, whether mild or severe. So certain drug medications, example which are diuretic drugs. Diuretic drugs, these are drugs that help to relieve edema. They can also be used to treat hypertension, that is high blood pressure. So patients on antihypertensives like diuretics are also likely to do what? To suffer from gout disease. So that still comes together with patients who have blood pressure, are also likely to suffer from gout disease. So like I've said, those are some of the risk factors that someone can suffer from gout. Like you have said, one is family history, a diet that is rich in seafoods, meat, and low in vegetables. So then also people who are obese or people who have much weight or too big, I will not say too big, but people who have much weight, that is also a risk to arthritic condition now we are referring to as gout. And also certain medications, like we have said, like diuretics can also predispose someone to have gout. And other illnesses such as kidney disease, diabetes, hypertension, like I've said, all these conditions can make someone suffer from gout disease. So although we are saying gout is a sudden and intense joint pain, joint swelling, there are some types of gout. We have acute gout, that is a sudden pain and inflammation of joints. What causes this is high levels of uric acid crystals that are being produced, that causes that these crystals now penetrate into the joint area and cause inflammation there, which inflammation comes with pain, inflammation, and reduced motility. So then you also have another type of gout we call chronic gout. So as you know, chronic is something that is lifelong, something that may not get healed tomorrow, today, or yesterday, next day, meaning it is to be there for some quite enough period of time. That is chronic gout, meaning you may have uric acid crystals in the body, but they may not make you feel the pain and the inflammation and the joint area at the moment. But as time goes on, as these uric acid crystals keep on building into the body system, at a given period of time you may start experiencing these signs and symptoms. And if for acute gout, if someone received these signs and symptoms, you feel you have joint pain, fatigue, inability to move, stiffness of the body muscles, stiffness of the joints, you feel there is paralysis at times when you take long when you are seated, characterized with inflammation or pain in the joints. So that's why it is important in most cases when you realize such symptoms, you seek medical attention. So we also have another type of gout that we call tophus gout. So tophus gout, this is a type of gout. It is a type of gout that is characterized by the formation of tophi, which are deposits. So tophi are deposits of uric acid crystals in the joints at soft tissues. So deposits of uric acid crystals at soft tissues. Soft tissue, I mean now the skin areas, so it can be almost body muscles. So that is what we are calling a tophus gout, or gout that is resulting from deposit of uric crystal acids at the soft body tissues, that is tophus gout. So in most cases, on clinical history, on clinical assessment, we can tell which type of gout is a patient suffering from. It may not be the patient to tell what type of gout he or she is suffering from. So through physical examination, physical assessment, we can tell which type of gout our patient is suffering from. Now, how do we manage gout? If someone has gout, what is the way forward? And how do we best help our patient? Or if it is you now, the patient, and you feel the signs and symptoms I've talked about, maybe you have one or two, and the best recommendation I can tell to such a patient or to you, a patient, is go and seek medical attention, because not all joint pain may be gout. Not all joint pain may be a sign of gout, because some other lifestyle activities like strenuous activity, someone has been, use an example, if you have been in the beach, you have done a lot of practice, you rest, you feel joint pain. Yes, that doesn't mean you have gout. Some may just be simple arthritic conditions that can get relieved by their own. So such a patient, one thing I recommend you is go seek medical attention to any recognized facility or qualified medical personnel for further assistance. But some of the treatment remedies or ways we can do away with gout or such an inflammatory condition. One, we shall start with the non-pharmacological methods. So what are some of those non-pharmacological methods I can use, I can do to get relief of gout? One of them is diet, like I said. And we said what causes gout is, or what can predispose someone to have gout is a diet that is rich in most of the food content that I said, meat, seafoods, name them all, and lacks some green vegetables. So such a diet can also predispose someone to have or to suffer from gout. So the most important thing is to always have a meal that consists of all those green vegetables like we mentioned above. Make sure your diet is full of greens, your diet is full of vegetables. It's always good to supplement a food diet, at least if you're eating a meal of rice and meat, if I may say, it is complement it with some greens, complement it with some avocado, complement it with some lemon, it can be lemon juice, complement it with a watermelon. So why we are trying to fight the effect of production of uric acid crystals where in our body. So diet is one key someone has to use to really get rid, and this does not only apply to someone who has gout, no, but it can also be help in prophylaxis or in prevention to make sure this gout does not increase or grow in such a way that it can move from acute to chronic type of gout. So the next treatment, non-pharmacological treatment remedy you can use here is lifestyle modification. Making exercise is one of the best way to get relief of gout. So make exercises. If you raise your obesity, you raise your risk to obesity, you have much weight or abnormal weight gain, we encourage you to carry out lifestyle modification changes. For example, carrying out exercises that are going to help reduce this excess body weight and keep a normal saturation of blood within the body. Still, if you realize that if you realize your obesity or a patient is obesity, we encourage you to try to take lifestyle changes that are going to reduce on overweight. For example, morning runs, bedtime exercises, fasting that is intended, like you can fast once a week, twice a week, depending on how best you feel your risk to, or how a health work would have told you to really get with this. So the other non-pharmacological medication one we can use is through counseling sessions about how to manage your weight, about how to manage your exercises, about how your diet. So seeking for these various counseling services can help someone get relief of gout. So the pharmacological ways we can use to manage gout is, now this is to health work, but to a patient we don't recommend you to go and buy this drug and take self-medication, because that is not allowed. But for better learning purposes, one of the drugs we can use, we need to use drugs called the non-steroid anti-inflammatory drugs. Non-steroid anti-inflammatory drugs, or what we always call as the NSAIDs. So the NSAIDs have three properties. They have an anti-inflammatory property, they have antipyretic property, and also have antipyretic. So antipyretic, anti-inflammatory, and pain or analgesic effect. Those are three properties. And realize that one of the signs and symptoms of gout is inflammation, it is pain, and at times fever. So the first treatment here we recommend now is use of an NSAID drug. And amongst those drugs we have ibuprofen, that is most common on market. We have indomethacin, we have diclofenac, we have aspirin. So we have very many of them, but the drug I will prescribe or prefer now in this case is ibuprofen. Considering some of the signs and the side effects of ibuprofen, and that is gastric ulceration. So if someone has peptic ulcer disease or gastric ulcer disease, you can opt for another NSAID or another steroid anti-inflammatory drug other than an NSAID. But the drug of choice now here I would recommend is ibuprofen. Though you can use other steroid drugs such as prednisolone, you can use hydrocortisone, those are the corticosteroids. Either hydrocortisone you can take hydrocortisone IV, or you can use hydrocortisone creams smearing around the joint areas. Two, we can also use analgesic drugs, because we realize that gout comes with pain, and pain is one of the discomforting sign and symptom. So in order to get rid of this pain, we need some analgesic drugs. And here the word some of these analgesic drugs here we shall recommend now. This pain in most cases may be manageable or may not need strong painkillers. So we shall use, in this case we shall use paracetamol. Yes, we can use paracetamol. We can use diclofenac, but paracetamol is okay. We shall go with paracetamol unless when pain is intense and we really feel pain has to be put down, but we shall use now paracetamol. So another treatment drug here we can use methotrexate. Methotrexate is a drug of choice now here in managing most anti-inflammatory conditions, arthritic conditions, and now gout here. In this regard, we can use methotrexate, putting it in mind that methotrexate is one of the drugs that is most effective as far as inflammatory conditions and gout or arthritis is concerned. But one of the signs and symptoms, so the side effects of gout, is hepatotoxicity and hepatocyte damage or liver damage. So the best drug formulation, you shall take tablets. So here now, you either take tablets 2.5 milligrams 2.5 milligrams TDS, 2.5 milligrams TDS. That is now 3 times a day. Meaning by the end of the day, by the end of the 24-hour day, you shall have taken 7.5 milligrams once a week. Or you can take 7.5 milligrams OD for once a week. Why is it taken once a week? Because of most of its side effects. So we shall use methotrexate at 7.5 milligrams OD once a week, or 2.5 milligrams TDS once a week. We can also use other drugs. If you can't find methotrexate, you can use colchicine, you can use gemfibrozil, but the most common you shall use methotrexate. So that's now the pharmacological management, how we want to manage this gout. Pharmacologically, also we shall use ibuprofen 400 milligrams BD for around 6 days. We shall also use paracetamol 500 milligrams TDS for around 5 days. We shall also use methotrexate 7.5 milligrams OD once a week, or 2.5 milligrams methotrexate once a week. So we expect most of these inflammatory illnesses to get relieved at least in the first 3 weeks. That's when we expect to have changes or to have relief of most of these anti-inflammatory effects. But still, if these illness, the clinical pains, illnesses don't get relieved, we recommend you to come and see medical personnel. End this lecture, end this tutorial by thanking everyone for having taken your time to really watch this video. Please like and subscribe to my YouTube channel, my TikTok account, the Facebook page. Vitegeka Tembo Derek is my Facebook page. Abitex Tembo Derek, John Derek, sorry. My YouTube account, that is Abitex Derek. My WhatsApp number is 0759 192193. So feel free to inbox me on my WhatsApp. You need some further treatment, you need a medical recommendation, or want to schedule an appointment. That's my number, 0759 192193. I wish everyone a blessed day. Thank you for taking your time, and may God bless you.